From Robert Wood Johnson University Hospital, this is Medically Necessary.
Welcome to Medically Necessary, the official podcast of the Robert Wood Johnson University Hospital Medical Staff. I'm Chris Hoenig, joined as always by Dr. Jim Salwitz. Dr. Salwitz, another beautiful day in the medical neighborhood.
It is, Chris. It is. I think we're plodding through it, learning a lot. There may be a light at the end of the tunnel. I think people are actually getting vaccinated. So I'm pretty optimistic, that we'll turn the corner soon, but it's still a pretty hard time. And I think, as you know, the United States is hitting some of the highest numbers it's had. In New Jersey, I think, hit the highest single day it's had as far as outpatient new diagnoses. So we are still fighting the COVID battle, unfortunately.
Yes, that light at the end of the tunnel. Robert Wood Johnson University Hospital, we will be vaccinating some members of the public. That program will really kind of start in earnest later this week. We'll see it a lot more next week. The courtyard's going to look completely different than it has even up to this point with the vaccinations. As we expand that use, New Jersey, of course, now opening the vaccinations, basically everybody 65 and over, anybody 16 to 64 with those high-risk conditions. So definitely a time of change coming. And talking about the peaks that we're seeing in New Jersey and in the United States, it is a different world out there outside of the country. So acquaintances I have from my previous life in radio who live on a yacht full time have spent the past 4 months in Fiji, where it's just amazing. They shoot videos, and it's just amazing because you would never realize COVID exists. Of course, getting into Fiji took COVID tests and documentation galore, but now that they're there, it's like it doesn't exist.
They have to worry about sharks, and I worry a lot about sharks. So.
Yes, that of course, the big danger. I want to welcome our guests today because this is a chance for us to get really that interesting perspective of what life is like in an area where COVID really doesn't feel like it exists. Dr. Dalilah Restrepo, a new member of our medical staff here at RWJUH, who presently is in New Zealand. And so you're joining Dr. Tracy Zivin-Tutela's practice. Dr. Zivin-Tutela, you are with us as well. So thank you both for joining us. First of all, how do you know each other, and how do you go from medical school in Columbia, I believe, to internship and residency in New York and now New Zealand?
Yes, I do hop around, right, when you put it that way. So I did my fellowship for infectious diseases in Mount Sinai, and the fellowship where Tracy was in the west side of Manhattan used to come and do transplant ID at Sinai. And so when I heard, there's a visiting fellow coming to join you next month, and you'll both do transplant ID together, in come Tracy, and that's how we met. So we met at Transplant ID Fellowship in Sinai in Manhattan. So that's, and from then on, it's been happily ever after. It was love at first sight. So we've been working together pretty much ever since in some capacity or another. And so I joined Tracy for private practice in Manhattan for 10 years, and then life somehow brought me to New Zealand. It was about 2018, and I received an email, just a random email. Hey, would you like to come to New Zealand and work here? And I thought it was kind of a funny email, but I figured, let me just look into it. Who knows? It was more out of curiosity and just kind of a jokingly matter. And when I started to look into it, I was intrigued, and I was interviewed by a whole bunch of American doctors, and they were all here and quite happy, and nobody was burnt out the same way that we were in the States. And it was just, I don't know, it felt like maybe a refreshing change. And I consulted with my family, and after much deliberation, I decided, why not? It's 1 year. 1 year, what could happen? So in March of 2019, I packed 9 suitcases and headed to New Zealand and to do 1 year locum infectious disease in the North Island. I live in a very small town near Wellington, but it's a very small town. And so I joined Mid-Central District Health Board as their infectious disease consultant. And that's, that was pretty much it. My contract was supposed to end March 24 of 2020. And 2 days later, we went into full lockdown. And so that's really what happened. And I ended up staying because I am the only infectious disease doctor here. And I said, I can't leave this community now. So I stayed. And Tracy and I would be on the phone every day between like mid-March, really, when we knew kind of what was coming, just following the data, following the numbers, what's going to happen, what is this, do you think this will be something? I saw my first case, not of COVID, but of coronavirus. It ended up being just one of the normal coronavirus, but this woman had been all over Asia, and we thought this could be it. And it was just constant communication with Tracy as to how are we going to deal with this, and sharing information and sharing protocols. And it's been, I don't know, Trey, I wake up at 4 a.m. and I start texting you every day, and I don't think that's changed in the last year. So it's really been a very different response. Over the months, it started to diverge, right? So we thought we were going to get hit really hard, and instead New Zealand approached it with a different strategy. At some point, it changed from just using the influenza pandemic playbook to really approaching it as an elimination strategy. We saw the golden opportunity of geography, a period incubation that's different, and just said, the country said, we're going to do this differently. This is not influenza. And I just want to highlight that, because I know that early on, and Americans would call this this is just the flu. And part of the danger of calling it just the flu and even comparing it is that even from a public health standpoint, it's not even clinical, but from a public health strategy, this is not flu, and you can't treat it the same way. It's totally different, and it needs another playbook. And when New Zealand realized that mid-March, they changed the rules of the game, and so I think that was really very important, and so misnaming things is really dangerous. So Tracy's story and my story really changed from that end on, and Tracy would tell me another one. Now we're closing this. Now we have so many, and I couldn't believe what I was hearing, because I had a totally different experience here. We were waiting for that wave, but that wave really never came. Instead, we went into a full national stay-at-home lockdown, and that really, we did that for 2 periods of incubation, basically 5 weeks, a little more than 2 periods, but 2 periods of incubation to kind of die out everything that had already entered the country. And then once that died out, then we slowly started to reopen and then control anything that was coming in at the borders and preventing transmission onward from any cases that come in to New Zealand at the border. So our border is really our main line of defense. And if we prevent transmission into the community from any incoming cases, we can live in here in our bubble of 5 million, basically. So that's kind of how we are right now. But it was very interesting and really a privilege. And when I came here in March of 2019, I get a lump in my throat even thinking about it. But when I came here, I never thought that I would live this and here, but also I never thought I would get to experience what a real response should be, and how it really should be. And I just feel extremely privileged that I got to experience that.
Chris, before we set up this call, I think you did some kind of raw research on some of the numbers that Dalilah is basically were the result of the response that Dalilah was referring to, kind of just the raw comparison. Do you want to run through that quickly?
Exactly. Yeah. So that perspective, New Zealand, we're talking about a country that is approximately size and population like Colorado. So about 103,000 square miles, a population about 5.1 million. Colorado about 104,000 square miles and 5.8 million people. Colorado, we've seen over 365,000 cases of COVID-19, over 4,000 people dead. New Zealand, correct me if I'm wrong here, Dr. Restrepo, but we're talking about just over 2,200 total cases in the country in almost a year.
Right. So we've had 2,246 as of the 15th, and recovered 2,145. We've had 25 deaths. Sadly, we've had 25 deaths of COVID in the country, and basically zero transmission in the community. Every so often we have a blip in the community because of it infiltrates from the border. There's breaches at the border or so which we know are going to happen, expected to happen, and are prepared to deal with it. But every so often there'll be a little bit of community spread. But for the most part, all the cases are at the border. So new cases have, in the last 48 hours, 18, all in managed isolation, all caught in the borders. And there are active cases today. We have 76 active cases today of COVID in New Zealand, all in managed isolation. So when you look at that, so 76 cases active right now in the country are all in managed isolation. Those are 76 dodged bullets, right? So had there not been this setup that you come in to the country, you can come into New Zealand if you fit the criteria. It's not an open border for everybody, but they have some clear guidelines: critical worker, New Zealand residents, coming to care for a loved one, etc. There are some clear guidelines. But if you get re-entry permit, you can come into New Zealand, but you have to stay in a hotel for 14 days. The hotels are managed by the government. You get your 3 meals. They're 4-star hotels. I must say, I loved my time in managed isolation. So I'm kind of biased because I'm a closeted introvert. So I really didn't mind the 14 days of bliss and vacation, really, for me.
I was super jealous of the last 10, 11 months of being in COVID world in the US, that she got to have 2 weeks to herself.
Absolutely. You get your 3 meals, you get 3 days room service. Your laundry's done for you. I don't know, you walk 1 hour a day supervised. And you get, TV and Wi-Fi. I loved it. But you have to do that. During those 14 days, you get tested twice, at day 3 and day 12. And if those 2 tests are negative, then you are released into the community after you've completed your 14 days of period of incubation, basically. So that's basically what we have, and that strategy has really helped us.
Tracy, you've been talking obviously continuously through this experience. I mean, how has this helped you? I mean, obviously, it would frustrate you, well, as much as we'd like to compare Robert Wood Johnson for a 4-star hotel. It is probably not. How have you learned from this in your interactions, in conversations?
I think, we have gone through, Dalilah and I, a lot from March on. One of the biggest benefits was her being on a completely different time zone. So when I was home after 10 to 12 hours in the hospital, emotionally, psychologically, physically drained, she is the only person up at 3 and 4 in the morning, my time, that I could just run things by. Hey, have you found this in the literature? What's going on? We did not have a lot of information early on. And even to this day, I am constantly scouring new information because it just comes out, constantly. So what I think, which was really interesting, was the approach locally was really well led. It was, we're gonna separate off these areas of the hospital. We are gonna have dedicated nurses. We are gonna have physicians who are experienced, who know how to put on and off their proper PPE to protect themselves. And we very quickly, at Robert Wood, in the ID department and pharmacy, very quickly got together on multiple emails and phone calls and came up with, this is what I'm hearing. In the early March, April, we were getting information from New York and North Jersey, who were about a week or two ahead of us. So we would start these conversations, and that's actually how we led to guidelines. We very quickly came to very formalized guidelines so we could all, be up on top of everything at all times. You can't read everything at every moment, and the learning curve for COVID has been incredible and continues to be incredible on a daily basis. And so I feel like our local leadership was very good. I think from the state standpoint, we went into a lockdown. I think that was necessary at that time. I think that helped. And I think, opening up things within the state in a stepwise manner, even if there's a hiccup here and there, in general has been we've been very fortunate in New Jersey. On the hospital level, I just think there's been nonstop open communication, and that has been huge. The disappointment, the frustration, sometimes I will even see anger, has really been from a national leadership. And that aspect is more so because as an infectious disease specialist who trained and worked in Manhattan for a very long time, we had very good public health measures in place with our state and city and local departments of health, and within our hospital and our command centers and our division of ID. And so we've had Ebola walk in our hospital. We've had SARS, the original SARS. We've had MERS walk in, and we knew what we had to do and how to deal with it. And I feel like when COVID hit, all what I was used to from a Manhattan standpoint or a New York standpoint, and my training as a fellow, and then also as an attending and being responsible, that kind of all went out the window when COVID hit, because the national stage wasn't organized, and then that also left, local flustering a little too. And so I was super frustrated because I was honestly jealous of what they were doing in New Zealand. It was incredible. And you did not hear people in New Zealand, arguing about their right to leave the house. They did not argue, other than going to the grocery store or the doctors. They were allowed to do that. Everyone respected, this is what we need to do for us, my neighbor, our country. And that did not happen here. And that was incredibly frustrating to someone who was risking her life and especially in the early days where we just saw lots of people dying of all ages and had no idea, are we going to be next? We saw lots of our colleagues sick and very sick. And that part was very frustrating. And honestly, I was very angry, downright angry.
I really appreciate that.
Yeah, because you saw that it worked, right? It works. And if you do it that way, then it works. And that was even more frustrating by June. It was when basically New Zealand was deemed COVID free. It was even worse because that's all we had to do. And so it was very frustrating to listen to what was going on in the States.
It's interesting. I think, this virus occurred in the way and spread in the way it occurred because of international travel. 500 years ago, this virus would have hurt a small community somewhere in the middle of China, would have died out, but it became a worldwide phenomenon because of international travel and the ability, therefore, to spread internationally rapidly. You're both pointing out how important international communication, international coordination, national communication, are and can be a weapon in responding to this. This is not, if we accept the world we live in is now so interconnected that the butterfly wing that flaps in China, if you will, causes a calamity in Manhattan and across the world. Therefore, we all have to, be in this world that we communicate. And I think you're both pointing out in your own personal lives how the two of you have communicated, but also as profession, how the profession has communicated, the potential, for, these things are inevitable only in that they're going to happen, not in that we do have the tools, international communication, international working together, national communication, coordination to fight them.
Right.
Of course, this being a disease that, as you mentioned, also spread a lot thanks to international travel. Tourism in New Zealand makes up, between direct and downstream, about 10% of the country's GDP. We're talking tens of billions of dollars annually. Shutting down the country for 5 weeks, having restricted borders, I'm sure has not been easy from an economic perspective for the country of New Zealand. How have the residents, how has the culture of approaching this virus, of the acceptance of masking, how has that been there, especially with this added pressure now of having the impacts to such a large portion of the economy?
It's been extremely difficult. I mean, tourism is a big source of income here, and in our neighboring islands, which completely depend. You spoke of Fiji earlier, but I mean, all of our neighboring islands have suffered tremendously. So it is a big impact. We went into lockdown with having maybe like 100 and some cases, which is incredible that you would shut down a nation with just that amount. And but it was actually, instead of looking at it as we only have a couple of hundred cases, let's try to do contact tracing and do it that way. We saw it as like, this is a golden opportunity because we only have 100 and some cases, but there was already community transmission. So once that got out of hand, and New Zealand has made the same mistake as the States, that they underfund public health. So they were nowhere near the resources that were needed to control an epidemic if it really came in a flood. So they just looked at that. They said, okay, we don't even have enough contact tracers. We don't have enough public health. We haven't invested in any of this. We're going to have to shut down because we don't have the resources to take care of this properly. So that was really the drive. So as much as you get, New Zealand gets good credit, in honesty, they had to do it because they don't have the resources to take care of. But just recently, there was a publication looking at the effects and was this elimination strategy cost effective? And obviously it was. And so even from an economical standpoint, although it's been expensive and hard, it did make sense. So there is that. But I think also, I mean, the New Zealanders did a fantastic job, but there is also an element of luck. There is an element of geography that we cannot neglect. There is an island, so we have natural borders to begin with, and we have a population that is used to dealing with threats, natural threats, right? So, even our kiwi bird here is endangered. So when you come into New Zealand, even pre-COVID, you have to declare whether you have like even dirt on your hiking boots, or you can't bring any live plants or products or animal things. Like they're used to being an island nation. Anything that comes in here could potentially be a threat to their fauna, their flora. So it just seemed like they understand that concept, and so they're prepared. And when something is threatening the island and the animals and the plants and everything in the island, they come together and they can deal with this. So I feel like also that mentality, maybe we don't have that in the States really, because we're so privileged. We don't really have local threats. We've never lived through SARS. Like we didn't have that where other Asian nations and New Zealand had. So there is a little bit of that psychology in the people. So I think that also played a huge role. It wasn't 100% acceptance, believe me. I mean, there was a lot of controversy. What are you doing? How could you close the borders? The two parties differed in the way that they wanted to manage it. The difference is that people do what they're told. And then heads will roll later if they need to. But at the moment, the 5 million people did what Jacinda said, basically, and what the ministry said. And it was really a combination of leadership and science. And that marriage was very, very crucial into the response. You can't do it properly one without the other. You need the two of them. And that is what happened here. And if you add to that empathy and excellent communication skills, that was really the final seal of approval for the response, because the way the things were communicated here were always from a point of kindness, from inclusivity. It was the team of 5 million. Even if I said to you the team of 350 million, already you think differently of your fellow American, right? If it's a team of 350 million, just even like those simple messages. So for us, we had It was a team of 5 million, and we had to do it together. And any little, even a tiny little movement, but if you do the 5 million things, if 5 million people do it together, that unison, it translates into something massive. And so that's what happened here. Every day, I would tell you at 1 o'clock, Jacinda and Ashley Bloomfield would get on their announcements every day and tell us how many cases there were and where we were and where we're going. And it was just like the whole nation tuned into TV, and you just waited for 1 o'clock to see what was going to happen. And whatever they said, that's what went. And that's all you can do. I mean, there's no argument. It's just, this is how it's going to be. And even if they didn't like it, they would do it. So that was really impressive to watch. We didn't really have a mask situation because we were locked down, but the lockdown was very much respected. I would say really, it really was. I mean, I'm sure they had folks that tried to breach it and such, but for the most part, I would say it was very much respected, and so it worked very well. Because we went into that lockdown, when we started to reopen, we didn't really reopen with masks. Right now, we do use masks for travel, air travel, or public transportation in Auckland would require mask usage, and everyone abides because that's, it's just, that's the law. That's what you do. So you just put your mask on. If you're on a plane, you have to travel with a mask. But other than that, we're pretty much COVID free. But what we do is use an app. We have a COVID app in our phones, and we scan wherever we go. So we're scanning all the time, and we have the Bluetooth on. So in case it'll help contact tracing in case there's any breach at the border. That's so I do see a lot of uptake with the app. And checking into every place that you go into. But yeah, so I just think it was really well communicated, backed by science, and coupled with kindness. And I think that was a key combination.
Dalilah, have you been vaccinated, or will you be vaccinated?
I have not been vaccinated. We don't have vaccine in New Zealand yet. A couple of reasons. First of all, the main reason right now is that we don't have the refrigerators yet, but they're coming. But also, we didn't have that urgency. We're not in an emergency situation, so we didn't really need to run for emergency use. But it's in the works. So right now, all of the efforts are going into the vaccine rollout program and how that's going to be designed to vaccinate the 5 million. So that's in the works, but probably I would say April or something like that before we start to see any significant rollout.
What vaccine will they have, do you think?
Well, she bought all of them, so I think there's several, but Pfizer will probably be the first one to get. But I do believe she bought 7 million doses, and they're all with different manufacturers. So we'll have a
The two of you have obviously had a remarkable experience, through this entire event. Very different experience. Both are critical experience. You obviously learned a lot. I gather you're both taking that experience to Los Angeles, if I'm right, in a few days, or you're
Orange
both
County.
there.
Orange County,
yes.
In California. I gather you're both going there to relieve a couple of colleagues, who need some help.
Correct.
Yeah, so we're going to head out in about a week and a half, 2 weeks, and we're going to get, our first stop is to get Dr. Restrepo vaccinated. We're setting that up as we speak when we get out there, and we're going to give some much needed relief to colleagues who we worked with in New York, who have been where we were in the spring, and we didn't have a lot of, relief. So we are giving them a much needed physical and mental break. And it's what you do for friends. It's what you do for colleagues. It's the right thing to do.
It's what you do for patients, I guess, huh?
Yep.
Well, thank you both of you for both your service, and thank you, for your honesty and helping explain, particular experiences at an extraordinary time in science, in medicine, in the world.
Thank you. And I want to thank Robert Wood, because I don't know if Robert Wood Health System understands the impact it had on Mid-Central. I don't think they know how much they helped a little district health board in New Zealand, but thanks to our conversations with Tracy and our sharing of information, it really helped shape even our local policy and our local COVID protocols even here. In New Zealand, it's more dictated by the ministry, so it's not like every district health board does their own thing, but it did help me a lot in trying to advise the hospital of infection control policies and things like that. So thank you, Robert Wood.
Thank you.
Dr. Dalilah Restrepo, Dr. Tracy Zivin-Tutela, thank you both so much for joining us. Just an incredible perspective. New Zealand, actually, believe it or not, New Zealand, fewer cases than inpatient admissions with COVID that we've had at Robert Wood Johnson University Hospital during the course of this pandemic. So we've had just over 2,300, approaching 2,400 inpatient admissions at Robert Wood Johnson University Hospital. So just an incredible contrast in the approach of the virus, of course, the management of the public health aspects of it. So thank you both so much for your time. We really do appreciate it.
Thanks for having
Pleasure
us.
to be here.
We really appreciate it very much so.
And as always, you can subscribe to Medically Necessary on all of your favorite podcast platforms. We're available on Apple Podcasts, Google Podcasts, Spotify. You can also catch us on YouTube and on the RWJUH Medical Staff portal. For Dr. Jim Salwitz,
For Chris Hoenig,
thank you for listening.
Medically Necessary, brought to you by the Robert Wood Johnson University Hospital Foundation.